And okay, we're recording. We're good. Okay. Now, did you want to go first? Did you want me to go first?
All right. So I was assigned today to have two cases, right?
That was the original goal.
Yeah,
Um,
but
but honestly, right now, if you were able to get one, I'm okay with that. I'm
all
okay
right.
if we get docked. I think it was like 2 points. If we get
Mhm.
docked the 2 points, just because you had a lot going on. I've had a lot going on. So if we're on mutual ground that we're okay just to do one case each, then I'm okay with that. You know,
Yeah.
you
It's all
got to do
right.
what you got to do.
Yes, I prepared two cases. Yeah.
You're
And
good.
I'm going to submit the what is that? You're going to submit the recording, but I'm going how are we going to do that? Do
So
I need to
what I can do is I can because usually after the meeting is done, it takes just maybe a couple minutes for it to like convert to like
uh-huh.
a way I can transfer it. So once it's converted and everything like that, I can
Yeah.
then go into YouTube
Yeah,
and
right?
get it set up so we can have a link, and then I could just send the link to you in message if the wow brain words function come out the right way. I can just send it to you in a message if you'd like. Just, either on
Oh, all right.
and
So it is already converted, and I'm just only going to copy that and submit that with
yeah,
the
because that's what I've been doing is I've been having the formatting where I have like the case inform like the case study information, like the kind of like description of what was happening, what the diagnostic procedures are, kind of, what the treatment plan would be for each case. And then at the bottom I would put link. I'd
all
type the
right.
link and then have like where I'd click copy and paste the link.
Oh, so you've got so it's like the PowerPoint, and how do you do the one in the Word document or in the
I just
PowerPoint?
do it in Word document because
Word
I'm
document.
trying to get a PowerPoint done. That is like extra steps that I'm like I would love to have the time to do that, but I don't always have the time to be.
Word is much easier, isn't it?
Word is much easier because it's just for me it's just like I break it up like case study 1, case study 2, case study
Right.
3,
All right.
you know, ba-ba-da-ba-da, but I always at the bottom I'll have it where it says link. And then
And copy from you.
once YouTube gives me a shareable link, I just copy and paste the link. So usually it doesn't take super long. It just depends on how
Right.
nice
Okay.
YouTube wants to be. Usually I
Yes.
can get it done within the same night. But I can, like I said, once the meeting's done, it converts, I upload it to YouTube. I can copy and paste the link and send it to you,
Yeah.
no problem.
Yeah. So do you want me to make the Word document or and then submit it to you or pass it to you or
Yeah, if you want, you can even do it that way. You can just do the Word document, send it to me, and then I'll just add the link
oh
and
yes,
submit it.
please. Yeah. All right. So
Whatever is easiest
I'm
for all
going
of
to
us
send that
is what I will do.
on the message email on the on our course, yeah, right?
Yeah, Canvas
Uh,
Court, whatever it's called. I can't keep track
yeah,
of what they call
Canvas,
the
yeah.
system.
So because it's my first time to attach a Word document in there, and I will really try. And it's my first time, so yeah, I will learn how to do that, like attaching a Word document in there.
Yeah, it's all
It's so
good.
fun. I mean, it's fun learning this things, It's
Yeah,
really helpful. Yeah, at first it's hard, but if once you already learned about doing that, then you will be good.
yeah. And
Mhm.
let's see, 7:17. I mean, usually I go to bed around like 9 o'clock my time, and it's about like 7:17. So, once the meeting is done, that gives me plenty of time to get everything done. So it's all good.
All right. Okay. So, do you want me to? I haven't read all. Do you want me to? Do you want me to present the case the first case?
Sure, I'm ready. I'm
Okay.
ready to
All
do
right.
my little
So,
digging.
all right. So, case number one, we have a 62 years old female, and she's complaining that um she got a pain in her lower back, on his hips and on her hips and wrist, and yeah, and like her original height has been,
Shortened.
yeah, right, short.
Yeah. So I'm wondering, just I kind of have two guesses
Hmm.
because I'm not, well, actually technically three. Because it because of the height, shorts heightened. So is it, gosh, I really am struggling today. Hello, brain.
I
Okay.
said back pain, right? And on her lower back, and also on her hips and wrist.
Is it, I'm debating between either rheumatoid arthritis or osteoarthritis. Which one is
Yes,
it?
that is osteo.
Oh, oh, because I kind of got stuck for a second. I'm like, osteo? Rheumatoid? No, no. Okay. So I was
osteo
almost right.
osteopor
Osteoarthritis. Wow, that is a mouthful to say.
or osteoporosis.
Yeah, there's that. Which one is it then? Is it the osteo? Oh,
Like osteomyelitis, you're referring to that?
because there's three different versions. There's the
Yeah, right. They're osteitis, they're deformans, right?
because the osteoarthritis is. I know it's technically I think osteo. I always think it's like related to bones.
Yes, right, correct. You
So,
are
but if
correct.
she's having issues in her, ow, just
Yeah.
not
And sorry, I forgot about the fractured on the. Okay, so sorry. Can we rewind that one?
rewind. Okay, we're good. We're good.
Right. Oh, okay, all right. So I said I forgot about this one. 62 years old female, fracture. She got a fracture of the first lumbar vertebrae or on her back. You know, yeah. And then she is having a pain, really pain on her lower back and on her hips and on her wrist. And then her height was shortened.
Yeah, because I think with like the osteo.
Bone pain, really bone pain.
Yeah, because osteo, like the first part, the osteo usually deals with anything bone, but if she's shrinking,
Mm-hmm.
I still, maybe I'm wrong, but I still think that's osteoarthritis. Am I right or am I wrong?
Did osteoarthritis?
Yeah, is it
All
osteoarthritis?
right. I okay, so
Maybe.
osteoarthritis. So
See, I'm all
we have
discombobulated.
oh yeah. Or I have a wrong. Do I have a wrong? Do I have a wrong? Do
Let
I
me
have a
see. I'm
wrong?
gonna
Do
go.
I have a wrong case?
No, you're good because I'm like now I'm doubting myself. I'm like, wait, brain. Okay, so let's see.
But
Okay, so yeah, because it's joints, so wrist.
yeah, right.
So degenerative joint disease and chronic in the bones that results in generation of the, okay. Yeah, so oh
You
yeah,
know,
because it says
like this one, the vertebrae. It
yeah, the
is.
vertebrae.
Yeah. So that's why I said their height is shortened
Yeah,
because yeah.
because
So
it's
it's
osteoarthritis. Wow, I cannot. It's um my gosh, I cannot type today. Uh
all
yeah,
right.
deep
But my on what I have written here is osteoporosis. But with
yeah.
osteoarthritis, I haven't studied that one because I only studied the PowerPoint that was
Yeah.
yeah, so
You're
I just
good. You're good.
yeah,
I think because I know because if it's dealing with the joint,
yeah, right.
I think it's got to
So
be the osteoarthritis because that fell under the category of joint in the reading.
right, so bone pain,
Hmm.
and they are having especially on the lower back, on her lower back pain, and
Yeah, because
then
it's
hips
gonna be
and her wrist.
yeah, it's gonna be like weight bearing.
Yeah.
is where I was going to say, because it says the disease may affect any joint in the body, but weight-bearing ones, such as the knees and hips, are most often affected.
Mm-hmm.
So shrinking, I still, I still feel like
Yeah, shrinking because
I think that's going to be,
originally if they stand up, then that is their original height. But if they do like this, like there's a hunch,
yeah,
like that one, yeah.
because it's loss of bone.
The deterioration of the vertebral support, then their height is shrinking.
Yeah.
Yeah. So what do you guess? What sorry, what guess. What is what is your what is this case? What
I'm
do you think?
I'm still stumped because I still wanna say osteoarthritis, but I think you're right. It's osteoporosis.
Porosis?
I gotta go back because I
Yeah.
think I
So you can also tell me about osteoarthritis because osteoarthritis, it doesn't have that on the
where did
on
I
our PDF. Yeah, but they have osteomyelitis and osteotis deformans.
they have
Oh
too many
gosh, the
osteos in
name.
here. That's what it is. It's all throwing me
Gotcha.
off. I have like what I've recently read stuck in my brain, so I'm like, I gotta go back and look at my notes because I'm like, hold on, I'm getting myself confused.
Yeah.
Okay.
You have osteoarthritis in there, and I also would love to learn about that.
Yeah, osteoporosis. Let me go down here. Silent disease. May go undiscovered until ah, okay. Yeah, I think it's osteoporosis because you mentioned the fracture because it going back to the uh signs and symptoms. It says
Yes.
it can go undiscovered until
Yeah,
there is a presenting
exactly.
fracture. You're
Yeah,
right.
that's why I said I have to go back because there's
Yeah,
a fracture in my notes. It says fracture of the first lumbar vertebrae. So
that's
yeah,
what was getting me tripped up was the fracture.
correct.
I'm like, I was so gung ho on osteoarthritis, and
Yeah, that's why I said I have to go
I'm
back.
like, no, 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 brain. Like part of my brain was like
Sorry about
thinking,
that. That's why I said rewind, rewind.
I was like, hold on, wait a second. Nope, I had to go back and double check and look because I was like, nope, you're getting hung up on the wrong thing. So, okay, whoo, there we go. I got the right information. Okay, that makes sense now
All
because it was
right.
the presenting fracture. Yeah,
Yes, right.
vertebrae, hips, wrist. There
Yeah.
we go. Yep.
So this is the one, right? Like the signs and symptoms,
Mhm.
it may go undiscovered until there's a
That
presenting
fracture.
factor.
Yep.
Yeah. Right. So what do you think is the diagnostic procedure and the treatment for this?
As always, I think with you're always gonna want to do X-rays. Always gonna want to do X-rays because you're
Yes.
definitely gonna want to double check and see exactly, what where the fracture is, how the other parts of the area are looking. It does say it mentions in the diagnostic procedure in the reading, it mentions dual energy X-ray absorptiometry or DEXA. It's a diagnostic scan that PCPs use to
Yes.
measure the bone mineral density on
Mm.
sites, especially susceptible to fracture. So like the vertebrae, your
Yeah.
wrist, your. So that's kind of like a more fancier version of an X-ray because it actually goes in and gives the mineral density of the
Oh,
bone.
yeah. Right.
It does say regular X-rays can help, but sometimes in osteoporosis, it doesn't always help
Mm-hmm.
because the density of, let's see what it says, density of skeletal parts may appear to be similar to that of soft tissue. So it's kind of misleading to do a regular X-ray. So for diagnostic procedure, you would want to do the DEXA, which is that dual energy X-ray one.
Oh, so it's called DEXA in short, right?
Yeah, it's abbreviated to DEXA, which is much easier to say than dual energy X-ray absorptiometry. I can't say that last part. But it also mentions that doing blood test is good because that'll measure levels of uh, phosphorus, alkaline phosphate, protein, creatine, stuff like that in the bones. So that will help the diagnostic, but that that's smart. I
Yeah.
was like, it's this fancy. I'm like, what's the fancy name of that X-ray? I'm like, let me go back to my notes, and I'm like, DEXA. I'm just gonna call it DEXA because I don't want to try to say what the real name is.
Mhm. Yeah, it's my first time to hear that one. The about the dual energy X-ray. So it's called DEXA. So
Yeah,
I take note of that.
you're good. The last word is like i- it's like absorb, but it's like absorptiometry. I don't know. I can never pronounce it, so I'm like, I'm gonna do what it says in the book and
And
abbreviate
also,
it.
yeah, and also those medical team, they don't go actually with the, oh, do the dual energy X-ray absorption and the diagnose
Mm-mm.
this time. They
No,
will say,
they're
do
like
the,
CT scan,
yeah,
MRI,
CT scan. Yeah, right.
this. I know. I watch way too many medical shows and stuff that I'm like, yeah, abbreviations. That's the way to go.
Yeah, correct.
That's good.
And what do you call that one again for the providers, primary care providers?
Yeah. So the primary care providers use the DEXA to measure the bone mineral density.
Yeah, you said this is called PCP, right?
Yeah. I abbreviate it because my brain is hardwired to abbreviate because I did used to work in the insurance field many,
And
many
so
years ago.
these PCP are people
Primary
because
care practitioners.
yeah, right.
So
Right.
my brain is hardwired to say PCP because that's just how it is. Because I worked for a health insurance company for like a
Oh,
chunk
is
of
it?
years
Wow,
doing
nice.
customer service. Never again. Mm-mm. I will do customer service in any other area but healthcare because it's too stressful.
Yeah.
It does also say that you can do a bone biopsy and a CT scan as well.
Oh, is it?
Yeah, those are a couple other options. There's a
Yeah.
bone,
For osteoporosis.
yeah, for the osteoporosis. Those are another couple diagnostic procedures. Now let's see what we've got. Thinking about treatment plan.
Yeah.
So she's 63. So let's see. Does mention that the goal is to prevent fracture and control pain. So sorry, distracted by a siren in the background. I'm like, what is
Oh.
happening?
Yeah,
Police
it's alright.
siren. Too many. I always hear that in my room because of where my room is at. I can hear the street. I'm like, "Huh? Nope. Okay, so
Also, you are near the street. Your house is near the street.
it's kind of so like I'm in a little neighborhood and
Mm-hmm.
there's a street going out and then the main road. So it's
Mm-hmm.
the main road. I can hear
Oh.
sirens in my area of the house better than my parents can in their room. So
Mhm.
like I'm constantly like all day, every day, like I don't know, maybe once or twice a week I can hear sirens and I'm like, huh, what's happening? Is it happening in the neighborhood? No, okay, we're good.
Yeah.
It's people there's just certain points in areas in where I live that people just tend to get into accidents the most. So it's like, is it an accident or something else happening?
Oh, okay.
It's yeah. All right.
And also, I thought snow is fun, but seeing those accident caused by snow, I said, "Oh my gosh, it's hard." Also,
Oh yeah. Yeah, it's crazy because you never know exactly what it's gonna be for, if it's gonna be something minor or something major. And
yeah.
so if I hear just one, I'm like, okay. If I hear like a police siren and like multiple police sirens, fire trucks, because I can
Oh, there's
kind of tell
something
the
like that.
difference between them. If it's a lot of it all at once, I'm like, oh, that's not a good sign. But that
Yeah.
was just one, so
All right.
probably
So that is how
probably
it affects.
nothing, hopefully nothing too bad. But all right, so treatment. So we want to prevent fracture and control pain. So uh, any type of treatment plan for osteoporosis is going to depend on the cause. So it mentions increased dietary calcium,
Yeah.
phosphate supplements,
Mm.
multivitamins can be prescribed.
Yes.
So which makes sense, but it's trickier when you're like 63, 70, your bones as you get older are more brittle, so it's kind of like,
Yeah. Brittle
okay,
and
what can we do within reason
yeah.
depending on the patient's age. So
So so at this age, can we still drink milk so that we can have lots of calcium in there, or just take a just take a vitamin I the vitamins the calcium
I mean,
vitamin.
it being
Like me, I'm 43. And then my daughter said, "Why are you still drinking milk? You will get fatter and fatter and fatter." I said, "This is
excuse
wonderful.
me, child, no.
This is wonderful.
I mean,
It has calcium in it, so I need this one for my bones."
yeah, calcium is always good. I mean, it always is going to be good something. I mean, milk always going to be your greatest thing. I mean, I love milk.
Yeah,
I drink milk. I
yeah.
drink
So
I
to
drink it
prevent,
plain. I drink
right?
it chocolate
Prevent
milk.
osteoporosis, right?
Yeah, so yeah, any type of drinking milk is going to be good to kind of help with any
Mm,
of the osteo, if I remember correctly.
mm.
So,
I can still drink that, or
yes.
yeah,
Yes.
yeah.
Yes, you could still drink it. You're not you can
I
get
really love
some.
your reaction.
Kids sometimes. I'm like, I'm 30. I feel like I'm such a wise soul. Sometimes I'm 30 something and I'm like,
Mm,
sometimes I'm like younger generation. I'm like, don't you give me sass. Because let me tell you, I will give it right back. But yeah, I have my nieces and nephews that when they would tease me, I'm like, I could still, you're a child to me. You're always going to be a child because you're younger than me. So watch your sass because I can give it right back. So yep. Okay, yep. Dietary calcium. So yeah, dietary calcium. So there are, supplements and stuff. Some people
mm,
don't like drinking milk. Some people don't have access to milk. It kind
mm,
of just depends. So with it kind of does say though, if it's going to be a long term taking those type of medications,
mm,
that you want to talk to the primary care doctor because it kind of, it gets to a point where if you're taking the supplements, it kind of defeats the purpose, like it stops doing what it's supposed to do. So it's
yeah,
kind of you have to talk with the doctor and be like, okay, I'm 63, should I continue taking these supplements? Should I do something else?
yeah,
Um, so it's just kind of, talking with the doctor. It also mentions exercise can help minimize osteoporosis because it'll slow the loss of mineral calcium. But if the bones have become brittle, then kind of need to make adjustments with the exercise because you don't want to overdo it and cause more problems. So it's just talking with the doctor, based on your age, what you're already doing, what needs to be adjusted. Um, there are complementary therapy mentioned as well. Um, I love this though, because you are right. It says natural sources of calcium include milk.
yeah, right.
Yep, milk, yogurt, cheese, ice cream within reason though, I think. Sardines, uh,
Oh,
clams,
sardines.
oysters, and salmon. Anything fishy, I'm like, nope. I'll stick with my milk and my cheese and
Yeah,
occasional
right.
ice cream.
For the calcium, right?
I can't do
But I,
fishy
I
things.
also love fish because we are, like Philippines, we have lots of,
Oh
we are
yeah.
surrounded by waters. So yeah, we have a lots of fishes that we can cook.
Yeah. I
Yeah.
think it's like a combination of like I can't handle the smell and the texture. It's
Oh
weird.
yeah?
It's just
Yeah.
some foods I can't eat because it's a texture thing and it freaks me out, but I'll stick with drinking my milk.
It's just like my son. He doesn't also like the fish because of the smell. Like even though we cook it, he can still smell it. So
Yeah.
sometimes he said, "Ma, can I go just with an egg?" I
Right.
went, "Yes, I can fry egg." I said, "Okay."
You're like, all right.
Yeah.
So,
And
and
yeah, and yes, please.
I was also gonna say, um, your vitamin B, C, and D, as well
Yeah.
as magnesium can be
Oh
super.
yeah, magnesium. You know, I heard a lot of it from the TikTok world. Like when my because I don't have a TikTok, but my nieces and nephews have that. And then there are always there are lots of doctor talking about how magnesium really helps the body. And
Yeah,
I don't want to have that. I didn't think of that, like, oh, magnesium, and
yeah,
also what zinc. Yeah, I
yeah.
said,
Magnesium, zinc.
yeah.
Um,
Do we really I mean, so
it's more kind of, I think, based on like uh, as we always, I think, discuss every week, I think it really depends on the person themselves and what their lifestyle is.
I
Are they somebody that wants to do the complementary therapy? You
mm-hmm,
know, they want to do the natural sources of calcium. Are they okay
yeah.
to, do the vitamin supplements or do the magnesium? Also,
Oh,
it does
yeah.
say that you need to cut out your fatty foods, your fried foods, your soft drinks, caffeine, you know. You got to be careful with your diet. So I think treatment plans are like depending on the person, it can be a combination of medication and complementary therapy.
All
I think
right.
it's depending on
So, like at
who
my
you are.
age, so to prevent osteoporosis, I still have to do the complementary therapy, which I have to drink milk and eat cheese, those rich in calcium food. Yeah, right?
Yeah.
Okay.
Doing that, the
Here in
natural,
the Philippines, there are lots of older women in their senior age, like they are really shrinking because they have,
yeah,
yeah.
it's crazy. Yeah, and it's like if you can take the natural sources of, the calcium and stuff, always do that, but then at the same time you have to figure in that, milk is great, yogurt, cheese is great, ice cream within reason is good, but you don't want to like overeat on ice cream. It
I
kind of
love
will
ice
defeat the
cream too.
purpose.
I really love ice cream too.
Oh, I love ice cream.
What flavor do you like? Do you love?
I'm an all over the place kind of person. I love my vanilla. I love chocolate.
Mhm. Yeah, chocolate
I love
too.
mint. I love
Mhm.
strawberry.
Yeah, strawberry
Um,
too.
and then I kind of go my route of like sorbets and sherbets. I kind of like those as well. So I
Like
like,
I have taste an ice cream with the mint flavor.
oh,
We don't have that.
so good.
Oh yeah,
Yeah, my
like
favorite
it's
thing.
so cooling, and when you
I love it. I love getting like a mint chocolate chip kind of ice cream.
really like that one. Oh, I really like chocolate.
Oh yeah. Um
No, we're into ice cream now.
I know I'm like trying to I'm like salivating. I'm like, oh, ice cream sounds really good. And I'm like, I know we have some type of ice cream out in the freezer, and I'm like, no, you don't need to eat. I've had enough food right now.
Mm,
Um, so but yeah, so I mean it's a combination for the treatment plan. You can do both. You can do the taking the medications, the multivitamins, the supplements. You can do the natural sources of calcium for the complementary part. So it's kind of dependent on who the person is already, what their lifestyle is, what they're willing to do. And sometimes doctors kind of just
yeah.
may need to give just a little bit of a nice nudge saying, hey, this might be a better option instead of doing this. Let's try to cut down on the sugar in your diet to kind of help counteract the osteoporosis. So, but I mean, we kind of like talked about treatment and then kind of also kind of blended into prevention and stuff all at once, it seems like. Because prognosis basically um, is basically determined by the cause. So it's dictated by the cause of the osteoporosis. There's a concern, like I said, with the fractures. That's one of the biggest concerns. So as you get older, it gets a little bit more concerning because your bone mass weakens. But there are apparently drugs now
Yeah.
that can help restore lost bone and reduce the risk of fracture. So there have been improvements from many, many years ago to now. So every couple of years, it feels like something new comes out to help.
Yeah.
But one of the biggest things for prevention it does mention in this is calcium rich diet. So
Yeah. Right.
it's good. Yeah.
Yeah. All right. So case number one solved.
Woo! After
Yay.
much going back and
The
forth
next
because I
game.
kept getting stuck on osteoarthritis, gall, my
With the next game.
stubborn my like half of my brain was like it's osteoporosis and the other half, which is
Osteoarthritis.
stubborn, was like it's osteoarthritis. I'm like, no, it's not. It's just
Yeah.
all right.
So osteoarthritis is the aching of the joints, isn't
Yeah,
it?
it's more yeah, it's
It is more
still
on the
kind
joint.
of dealing with the bones, but it's kind of it's different than osteoporosis. I can never
Yeah.
pronounce that the way.
Osteoarthritis and osteoporosis. All right.
Yeah.
So case number one. So we are down to two. Your case and another one,
Oh,
another case.
I'm ready. I gotta go
Yeah.
back to my notes because I was like, what am I doing again? Okay. So I am what is trying to move my key on my keyboard and I got stuck for a second. That was weird. Sorry about that. Okay.
It's all right. It's all right. Step.
All right. There we go. Now I'm back in my spot. Okay. So we have a middle-aged woman
Mm-hmm.
coming into the clinic.
Mm-hmm.
She is experiencing dull muscle ache that is constant. Um, she has tender points that are on her top of her shoulder, outer elbows. She's constantly exhausted. She's having kind of issues with memory, trying to remember things.
Mm.
She's kind of constantly fatigued as well and kind of has some other mental health issues tying to this, such as depression.
Mm.
So it's big factor here is pain, and it's a
Mm-hmm.
constant dull muscle ache.
Mm.
So
So is it fibromyalgia? Yay.
yay!
Fibro,
Me! It's
fibro,
me! It's what
fibro.
I have.
Oh, really? Oh,
Hmm.
I didn't know that. Oh, how do you
Yeah,
pronounce
so
this one?
typically middle-aged women are
Yeah.
often most diagnosed, but you can be diagnosed younger.
Oh,
Yeah,
okay.
I was diagnosed, goodness graciousness, how many years has it been now?
Oh, no.
It's been a long time. Oh yeah, it's 2023. It's been, I think it was maybe 2014, 15. It was right before my sister got married, and she got married in 2015. So my mom was the one that kind of was saying, you need to go to your doctor. I think you have
Yeah.
fibromyalgia. I'm like, what do you mean? She's like, you're constantly tired, you're in pain.
Fibromyalgia. How?
I'm like,
Fibromyalgia?
yep, fibromyalgia. It's
Okay, fibromyalgia.
fibro. So it's like I had the spelling of it and then just clicked away from it. Okay. Move down. Okay, so it's like fibro is the first part of it, and then myalgia is MYALGIA.
Fibromyalgia.
Yep.
I
And
read the maps and the fractures too.
nope,
I
I'm nothing to do. Nope, no fractures with this. So, and this is going to be, it's going to be chronic. So it's going to be something that is with you for the rest of your life, basically. So, like I said, middle-aged women usually is where they get diagnosed the most, and it's more found in women than it is in men.
Oh, is it?
Yep, more women
So
get
more
it.
women for this sickness,
Sorry, say that again.
for this disease. Like I mean, for the ratio, like for the osteoporosis to more women like tend to have osteoporosis
Yeah.
than men. Yeah.
Yeah, it's found more in women than men, and it affects about 2% of the United States population, adult population. So it's like I said, it's it's the exhaustion, it's the pain.
Mm.
I've People always have asked me, well, what is it like? And I kind of explain it. The aches that you feel when you have the flu, magnify that by 1,000, and that's almost what it's like. It's it's a tricky one to deal with. Because you don't only have the pain, but you have the other things. You have common cognitive difficulties, which is your memory is just terrible. It's called fibro frog. Like basic things that you've known before are like not coming up. And with this, you can get other things tying into it. So mental
Like
health can kick into this.
yeah, mental health, like depression. It was
Yep,
on the
depression, you have post-traumatic stress disorder,
stress
um,
disorder too.
you can get restless leg syndrome. And the added benefit that they don't mention in the reading, if you are diagnosed with fibromyalgia, you also have the high potential of being diagnosed with ADHD. For whatever
Oh,
reason, there's a kind of a common link that you can have both at the
oh,
same time. So I'm like, okay, so I've got the fibro, I've got the ADHD, and I've got the panic and anxiety. I'm like, I'm just a little yarn ball of chaotic mess when it but it's a trickier one. It's not as easy diagnosed as it is for other ones.
yeah.
So I'm going to get down to my list. So what would you think would be a diagnostic procedure that they would do for this?
Right. It was we have to have physical examination,
Yeah.
especially about the pain that is showing. Is it on the body? So we have to have this physical examination, and it says 11 out of 10, 18 possible temper points. And also, um, of course, if we are having this mm, I I we can also have blood works with this one.
Yeah. Typically, blood work is how it kind of was determined, verified that I have it. It was how it was explained to me many years ago when I was diagnosed is that your blood will have certain markers or indicators for certain type of um, diseases like fibromyalgia, lupus, MS, rheumatoid arthritis, seronegative rheumatoid arthritis. So
Hmm.
it kind of you'll have more markers towards one disease than another. Physical examination, it does
Yes,
you'll
physical examination. But it says physical examination showing widespread pain in lasting at least 3 months.
yeah.
So yeah. So
It's
like within 3 months they're going to have physical examination with you. And if they see that you have this one, then they will say, oh, then they will
yeah.
five fibromyalgia. So it really, I mean, this
It's
sickness is really hard
yep,
to diagnose,
yep,
because
and it
they really have to observe you. You
yep.
really have to undergo physical examination within 3 months, especially with those pain. But what if the patient is always taking a pain, pain medication?
Yeah. That I
Yeah.
mean,
So to lessen the pain, so it's really hard to
yep.
diagnose this.
And it can get misdiagnosed so many times,
Yeah.
especially
Because,
because there's not an easy way you can do the physical examination, yes, because when you have it, there are going to be areas that when you are touched, like even just a
yeah,
gentle touch can be like excruciating pain.
it's, yeah, extreme pain.
You
Yeah,
know,
extreme.
yeah, it's just like certain areas are going to be more sensitive than others. Like, my shoulders,
Mm.
um, my shoulders kind of hurt more. My lower legs hurt more, and it's a dull ache, and it just is constantly just, it's not sharp, it's just dull and just annoying. It's like you're constantly being sick with the flu aches, but it's just not getting any better sometimes, and it's a pain. And the blood work that is done is, they'll have the markers because the will like, um, it'll have like the markers and it'll say this is more towards this is more towards that. They'll check your thyroid because thyroid function is,
Yeah, because while I'm doing looking for a case, and I read a misdiagnosed case of this fibromyalgia. So I
yeah,
didn't read more about that. So I jumped into another case. Like, I am looking at the osteoporosis, the case I'm presenting,
yeah,
looking at what is the same, the same signs and symptoms. So I said, yeah, but I have read that uh, there is a misdiagnosis with this case,
yeah,
and sometimes there is really.
yeah. It's constantly going back and forth between what causes it, if it's genetics and stuff like that, if it's something in the blood. Some doctors, I mean, many, 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 many years ago, doctors used to think it was all in your head and it wasn't something like,
Like emotional distress.
yeah, they're like, no, it's just in your
Uh,
head. And,
yeah,
it's more chronic. It seems like chronic illnesses
yeah.
are not always believed by some doctors. Other doctors do. I had a great doctor that
It's all
did
in the
recognize
mind
it.
effect. Like, it's all in the mind effect.
Yeah,
Yeah, something like that.
it's crazy. And
Actually,
there have
yeah.
been some studies saying that there's something in the blood, and
Uh,
it's constantly going back and forth, back and forth. So it's an ongoing thing. And when I saw that this was going to be part of the reading this week, I was like, yay.
yeah.
So what would
Finally. All
what would you think a treatment plan would be for somebody who has it?
right. So the treatment plan is, of course, the first goal is to reduce the pain. So we have to give them analgesic or pain reliever, and we have second goal in here to improve their sleep. Or for example, this patient who have this kind of who have a fibromyalgia and having a depression, then um we have to include an antidepressant.
Hmm.
Yeah. And it says anti-seizure if, for
Yeah.
example, if the patient is having a seizure, but the patient is having not a seizure. So yeah, and also physical therapy
Yeah.
for
It
our case, the middle-aged woman
yeah.
having, yeah, having those pain.
And it affects everybody differently. Nobody is experiences it the same. My
All
mom
right.
and we both have it. She's in her 60s. I'm in my 30s. I can get gnarly migraines to the point that it's debilitating. She
Mm.
never gets the migraines, but
Mm.
she can get to a point where her pain levels are so much that she shakes
Oh yeah.
and she can't sleep. And
Yeah, so that is the second to, yeah.
yeah, and so you have to try and find what works best. So, reduction
And
of
for your
pain is the
mom,
first goal.
anti-seizure if she is shaking.
She's never had to the point where she's had a seizure. It's more just that she's like shaking because she's so cold and in so much pain.
Oh, okay,
Yeah.
okay.
So
So no anti-seizure
no,
medication for her.
we both have been lucky that we haven't had to have that medication. We've both been lucky in that part.
Uh,
But, it all, like, it does state, reduction of pain is the first goal of treatment. So you have to find some type of pain medication that'll work.
Yeah,
So
right.
it depends, it says several different medications can be prescribed. Antidepressants such as duloxetine, which, is both, which I love that it mentions this. It's an antidepressant, yes, but it also can help with the pain management.
Yeah, right.
You can also be taking other medications that help with um pains and stuff. Like for me, I take duloxetine. I take a generic form of Lyrica, which is another drug that helps with autoimmune diseases. Um, I I take sometimes, if needed, I take some ibuprofen if I'm just kind of, if the medication I'm normally taking isn't doing enough, I'm just kind of having a little bit of extra pain. Sometimes
Yeah,
I need added, you know. But yeah, it's a combination of things of taking medications, reducing stress,
yeah.
physical therapy if you need it. I'm not at the point where I need physical therapy.
If we need the physical therapy, then we have to undergo physical therapy.
Yeah. It depends on how much it affects you, because like I said, it doesn't affect everybody the same, but it
Right.
also says, "Hey, this is good for you." Massage,
Yeah,
acupuncture,
massage. Yeah,
chiropractic.
massage. Yeah, right.
I'm like, massage, I'm like, nope, because it's certain spots in my body, on my back, if I get massage, it hurts too much. And I'm like, nope, don't want to be
Oh,
touched.
yeah, so no massage.
Yeah. It's not it's hard when you're balancing fibromyalgia and balancing ADHD, because
Mm.
fibromyalgia, you have the dull aches and the pains, and then sometimes with my ADHD I don't like to be touched at all. Like just the sensation of touch just like
What
overwhelms
about
me.
water spa?
It's
Like
weird.
like like the water spa. I seen that one. Like a man having those kind of pain, and he goes to the water spa. Like the water is, the water is
Yeah.
having like it's a massage, but the water is creating the massage.
Yeah. Like
Yeah.
for me, if I'm having some really bad pain days, I know that, warm hot water is, relieves
Oh, you mean
whatever.
the hot water one?
Yeah. So
Taking that one, you feel
yeah,
refreshing.
it does. It really does help. And I mean, sometimes it's just like I'll just stand I'll just stand in the shower for a few extra good minutes and just kind of lean my head down or lean over a little bit and let the water hit just that right spot in my back where I'm hurting the most, or my shoulders. So it's an ongoing process. You have to it's there's not really 100% of a cure. It's more of just kind of finding somewhat solutions that are kind of like band-aids
Mhm.
that kind of help, but there's no real way to kind of get away from it. It's just kind of taking each day as it comes, and you have to be really super careful to not overexert yourself, because for me, I love going to concerts. I love seeing bands, but I have to take a day off after for
Uh-huh,
recovery, because
uh-huh.
I'm in so much pain afterwards. And it's not
Oh,
like I'm going crazy and jumping around and stuff, because I can't jump around, but it's the excitement. It's just,
uh-huh.
even just moving kind of like this. It's not, it's, you have to be careful not to overdo it, because overdoing it can cause a flare up of the fibromyalgia. So it's
Mhm.
constantly back and forth, back and forth. So for the patient, she's a middle-aged woman, is she working? What can her work provide her for accommodations? It's kind of like you have to look at each individual case, because each individual person is going to have a different treatment plan, different prognosis. So it's chaos.
Yeah.
It's chaos, and unfortunately there's no known prevention for it. So we just kind of
Mhm.
have to
No tension. Yeah, none.
take each day. But yeah, that's the wonderful world of case study of fibromyalgia and me spouting off about my experience with it, because if I'm going to have a case study and talk about it, I might as well talk about my own experiences with it, because firsthand experience is always good to know. And I do pretty good. I do, fairly good. If the weather changes drastically, though, that can cause me to have some bad flare-ups. And sometimes I have to miss work because I can't function. I'm in too much pain and I can't get out of bed or I'm having a migraine. So it's all sorts of craziness. But we got with that case study. And when you're ready with your last case study, I am ready.
Yes, all right. So this is the last case study. All right, so 16 years old girl brought to an emergency. She sustained injury. Her leg was deformed, swelling, and having discoloration.
Ooh, well then. Now I'm really thrown for a loop because So discoloration. So she's 16 years old.
Yes, right.
Deformity.
Yes.
Discoloration. What is that gonna be? Let me go
Yes, you
back
can.
to my trusty note.
She is an athlete one, and doing the sport she loved to do, she retained an injury.
Ooh,
Yeah, a leg injury.
like is it? Ooh, hold on. I'm getting into my notes. I'm like, wait. Oh, it's a leg.
Yeah.
Mm, it's it better not be one of those osteos again because I'm like,
No.
So
Like
discoloration.
yeah, discoloration and swelling and deform.
Why am I struggling to not remember what that is? Brain. You should know what
And
that
having a lost limb function, like her leg, she cannot really move.
is. It a fracture?
You got it correct. It's a fracture.
I had to go back. I was like, wait a second, I'm making this more complicated than it really is. I was like, no, it's a fracture.
It is a fracture.
So common with people who do sports.
Yeah.
That's why I'm
And
glad I didn't
yeah,
do sports.
fractures and dislocations, right? If you are into sports, then you have this two kind of um disease or sickness. How do you call this one? Yeah.
It's
So yeah, so it's a fracture. Really, you got it correctly.
I was like, why am I making this more complicated than it is? And I'm like, I'm going, nope, I'm making this way complicated. And when I was reading, I was like, oh, there's a lot of different types of fractures that I didn't realize before. I was like,
Yeah,
okay.
I only have fractures in here.
I was like, oh, okay, I've heard of like some of them before, but I'm like, well, I didn't, because I know I've know there's a simple fracture, there's a closed simple fracture, there's an open or compound fracture, there's
Yeah.
a green stick fracture, and I'm like, there's so many different. I'm like, why can't we just call a fracture a fracture? But I'm like, no, it kind of makes sense if they're kind of impacting certain areas, if they're, you know, presenting a certain way. So that makes a lot of sense. So
Yeah.
obviously, yes, common symptoms are going to be acute pain of the affected
Yeah.
site,
Right.
deformity, swelling, all the good fun stuff. So of course, there's going to have to be that all encompassing medical history. Has there been fractures before? Have there been injuries before?
Yeah.
Is there a history of, you know, other my mind is like I look right at the screen. Kind of, history of traumatic injury, but also I think you kind of want to factor in bones, and do a bone scan, kind of see if others in their family have been susceptible to fractures before, like if their bones are weaker, so they fracture more. So
Yeah. This woman is really athletic, and she get the fracture doing the sport she likes.
I'm glad I was never good at sports because I'm like I would never want to deal with a fracture because they're too painful.
Yeah.
So I know that there's not going to be any complementary therapy for this, so that takes that part out of the way. But typically, I know that it mentioned immobilization of the
All
affected
right. Of
parts.
course. Especially for the leg part. She have to have do it in a wheelchair, or maybe the
Yeah,
use of what do you call that one?
Crutches?
Yes, right.
Yeah. I had to think
Yeah,
for a second too. I was like, crutches? But also, if there's, if there's bleeding, make sure that you control that.
yeah.
Um, Sometimes surgery might be,
And also some fractures we need to put a cast on them, right?
yeah. It depends on like really how severe the fracture is,
Right.
what the treatment course is going to be. Is it going to be surgery
Uh,
because it's so severe,
yes,
or is it going
surgery.
to be just a cast? We're fine. Um,
Yeah.
so
So either surgery and put a cast. Yeah.
yeah. Ooh. Yeah, traction may be used especially for fractures of the leg bones when a splinter cast doesn't work.
Mm.
So, and of course, there's not going to be any complementary therapy because it's a crack, it's a snap of the
Yeah.
bones. So, I love when I was reading that. It's like best prevention is conscientious adherence to safety rules at work and in play. I'm like,
Safety.
yeah, I would hope so.
Yeah.
That made me chuckle while I read. I was like, oh, I would hope you would kind of think,
Especially if we are doing so much or extreme sports, right?
yeah. Yeah, I mean, fractures are so common in like football and soccer, and
Yeah, correct.
that's crazy. It's like, and also dislocations can
Yeah.
happen too. And I'm like, oh, this is why I'm glad I didn't do sports because I'm clumsy as it is. I would be one of those people that would constantly be getting injured because I don't know how to walk. I trip over my own feet.
Yeah.
But yeah, that was really, gosh, you
Yeah.
ended on like an easy one.
Yeah. So I will going to type the cases in one word file, and I'm going to send that to you.
Yeah,
Yeah, right.
yeah. Because if I remember correctly,
Mm.
let me go back in here because I managed to click out of things because I think, let me see. Ooh, ooh. Yeah, as long as it gets turned in before the 21st, we're fine. So, if it takes you a little bit longer and I don't get to it tonight, I can get to it
Yes.
tomorrow.
Okay.
So don't stress about it. Be like, I gotta get this done, just
Yeah.
take a deep breath, you know. If I don't finish it tonight, I can get it
Yeah.
tomorrow. It's no
All right.
problem.
All right. So either I can send you that on your morning time.
Yeah.
Yeah.
Yeah. I mean, even if usually, because I get off at like 5:30 my time,
Uh-huh.
and Fridays, like I go to bed late on Fridays, so
Mhm.
I can do it whenever. So we're good.
Okay.
Because
Okay.
like I said, I have so much
Yeah,
time to kill.
because today is your Thursday night, right?
Yeah, Thursday night it's
Yeah.
like,
Yeah. And it's my
eh,
Friday morning.
yeah,
So
it's like
later on
your
will be
Friday, my Thursday.
Oh, okay. So can I also send this one either Friday evening?
Mhm. Yeah, you can, yeah, whatever is easiest for you. If you need to do it later in your evening,
All right. Thank you.
because like I said, I'm good. I have time to kill after work tomorrow because
Yeah.
it's
Oh,
Friday.
I also need that one.
Friday. I need a break. I need a vacation.
Oh,
That's
yeah.
not gonna happen for
Everyone.
a
Yeah,
while.
I also need that one.
I
All
know.
right.
Oh, no.